Okay, good morning. Welcome. Tuesday morning live Q&A with the Pharmacist. I am Dr. Sarah Morrissey. I am an integrative health practitioner and a doctor of pharmacy. I work up at the Moses Lake Professional Pharmacy where we do bioidentical hormone replacement, and we believe in helping people feel their best without the use of a lot of chronic, say, medications. We like to make sure we're doing the best for our bodies, healing our body from the inside out, focusing on our diet, our sleep, our exercise and movement, and just keeping an overall healthy body so that we can live each day to its best. So I would like to welcome any questions, comments. If you've watched this before, give me a wave, a thumbs up, something. Just kind of a weekly check-in. How has everybody's week been? We are now, almost to the end of February already. I keep thinking we're at the beginning of February. We are not. We are almost into March. So if we kind of reflect back a little bit on any of the goals that we have created for ourselves, maybe say the New Year's resolution, things like that. How are people doing on that? I can kind of reflect a little bit on mine. It has been rainy as heck here the last 2 days. And so since I don't have to go out and walk in the rain, I found my good old friend, the stationary bicycle, yesterday. So I had to take all the clean clothes off of it because, yes, it got used as a drying rack. And, guess what? I started using the stationary bike again yesterday. So that was awesome. And so just sharing that, because I had a long day of being at this computer all day long. And so I just took and made a note to make sure that I took the breaks throughout the day, even if it's 5 minutes, right? Take 5 minutes. If you're going to do your doom scrolling, whatever you're going to do on your phone, social media. I was trying to check in with some emails. I was like, wait a minute, get my butt on the stationary bike and, use it, right? And so that was super good. And a fun little reminder for anybody else out there that has relegated the stationary bike to your clothes hanger. So anywho, one of the topics that I would love to talk about today is one that I have struggled with as far as educating myself about things that I've learned. We learned a little bit about it in school, probably experienced a little bit of the situation as well throughout life, especially in teenage years, things like that. And that's iron deficiency. And I'm kind of putting myself out on a limb here because I can go through somebody's labs and I can reference back and it all makes sense, right? I'm like, okay, well, this makes sense and this makes sense. Okay, well, now I'm going to try to teach it. So bear with me and feel free to ask questions because I think it's something that a lot of us don't know enough about, right? We've heard the terms anemia, low iron, things like that. Well, so maybe I'll just start with, what are some of the symptoms? Have you ever experienced fatigue and low energy, weakness, hair thinning, dizziness, lightheadedness, cold hands and feet, right? Poor circulation, brittle nails or like spoon-shaped nails. Do you bruise easily? Do you just have pale skin, right? You can see it especially in like children, where they're just got that kind of pallor, pale look about them. That's a key sign. Difficulty with like some shortness of breath upon exertion, right? Really difficult to recover after exercise. Chronic infections. And then, some of the things that are a little bit less predominant, things like tachycardia, which is like a racing heart, right? And your body's just trying to deliver more oxygen to your body. Restless legs, or if you've noticed anybody, it's a condition called pica or pica, however you want to say it. And, craving for like non-food items. So like a lot of ice chewing, and then, eating dirt, things like that. So just kind of some interesting symptoms out there. Now, the kicker with a lot of these symptoms is that they look very similar to maybe thyroid issues, which makes sense because iron and thyroid, they do kind of intermingle, right? And so just kind of some, some information to throw out there. So how can you be sure if you have low iron, and what's the best way to go about that? Well, the best thing is actually blood work. And so you can ask your provider to run a full iron panel. The problem is that most conventional medicine doctors, they just kind of run what is called the TIBC, and that's the total iron binding capacity. So that's a measure of how much iron the blood is carrying, but that's kind of like useless iron in a way, right? So we want to know more of the story. And so be sure to ask your providers to run the full iron panel, right? So you want serum iron, you want the total iron binding capacity, you want your ferritin levels. That's kind of the most important one, because that's one that indicates, that's about the stored iron in the body, right? And so I guess kind of a side note to a lot of like the lab testing, for an example, would be, say, vitamin B12. If you get a blood work panel and it just gives you your vitamin B12 level, okay, well, that's great. That is the amount of B12 that's circulating around in your blood. Okay, but that's not telling you what is being utilized. It's kind of like looking out at, say, the city and all the people walking around. Okay, well, they're all walking around. Okay, but who's building, who's doing the work, right? And so we want to know how much work is being done by that B12. And so that would be where we would do, say, an organic acids test. That can be an at-home lab test. And you can learn exactly how much of the B12 that is circulating is actually being utilized and how your body is functioning with that. So just kind of a side note, right? Like there's just a lot of lab tests out there that are great, but they don't always tell the whole picture. And so that's why it is so neat in what I do now with the functional medicine labs, teaming up with blood work. And so we really get the full picture of why things are the way they are. So yeah, so just kind of, that's the thing, right? If you're just learning about the total iron binding capacity in your body, it's not telling the whole picture. It's just basically, saying how much iron is floating around that is bound up, not the iron that's actually going to work. So just to know that. So as a patient, as a client, you have the right to request your specific blood work. Because if we really want to think about it, and I know this is going to maybe make your head kind of, swivel a little bit, but doctors work for you, and I guess we've always relied on them just to be, like this ever flowing wealth of knowledge, and just whatever the doctor does is what the doctor does, and we just listen. Okay, but this is your body. And if you have questions about your body, you have every single right to ask for whatever labs you want, right? Now, if you're in the insurance, under the insurance hierarchy, quite often insurances might not cover what you want to know about your body. So think about that. Just know that you have the right to ask for whatever labs that you want to know about your body. And don't be afraid to do that, right? Your doctor might be, well, you don't need that. Well, I don't care if I don't need it. I want to know that information. And so just be strong with that. And a lot of doctors would be like, oh, well, yeah, maybe that's a good idea, right? So I can't speak for them. But I do know that it is hard as a patient to, go against everything that the doctor recommends. However, once again, it's your body. You have a right to know whatever levels you want to know about. So do that. And if you have questions, let me know. And because that's where the functional medicine labs come in as well, where they're at home, right? You don't need to have permission to get them, right? And so those are things that really give an amazing look into the root causes, the imbalances that are going on, because once we balance the imbalances, things get pretty good. So does anybody have any questions on running iron labs with your doctor? Because that's kind of where I'm at in this discussion today. We've got quite a few viewers. I apologize. My house is a tick chilly, so drinking some tea. It's very enjoyable. So that's, looking at those symptoms, looking for that blood work. Who does iron deficiency affect? I mean, it can affect everybody. Children quite often, and that goes back to a lot of our, what we consume. And so children, the elderly, because they're not consuming enough, it's all really about consumption, right? As far as the children and the elderly. Now, for premenopausal women that are still cycling, now we've got an opportunity there to possibly lose more blood, become anemic that way. All things to kind of look into. And then pregnant women, just because they're utilizing more of it. So as pregnancies go on, they usually do require more and more iron-rich foods as the pregnancy goes on. So those are kind of the, it can affect everybody, but those are the most common populations that the iron deficiency does affect. And then there's so many things that you can look at where the markers might be normal, but you're still feeling like crap, right? You're still exhausted. You've still got the weak nails and the thinning hair and the cold hands and feet. Okay, so I guess whenever I see those types of things or hear of those things, I want to look at not only the full iron panel, I also do want to look at hormones and our thyroid function. So just to be, because I feel like a lot of us, especially on this page where we do a lot of work with hormones. And so we really get down in that direction. And so when we add in searching for the iron component, that really does make a huge difference in our patients. So that's that. Because quite often we can have good iron levels, but you're still not feeling good. So it might not be an iron issue per se, right? You've got plenty of iron cruising around in your body, but why is it not being utilized? Why is it not getting into stored function? And so that's where we have to look at the cofactors, right? Cofactors are what are the little helpers that help, nutrients work in the body. They help every cellular bit of function, energy production, all of those things. And so that's where quite often it's not necessarily an iron issue, but it's a cofactor issue. And so making sure that people are getting a nice quality activated multivitamin. Looking once again, vitamin D, every week. I'm not sure if I've not talked about vitamin D. So vitamin D is huge. Balanced zinc. So zinc and copper are very important for iron function as well. And it's making sure that they're balanced, right? Because quite often if we're too high in one, it kind of shuts out the other. And so it's just making sure that those things are balanced. Magnesium is also an important cofactor with iron. And then for those that do take iron supplements, we have to be really careful, right? We want to be taking them with, making sure we're taking them with vitamin C, because that's a very important cofactor for the absorption of the iron. And so, and then making sure that you're not taking it with any dairy, no calcium, things like that, because the calcium binds it and then it doesn't even work, right? So, so you could be taking all these supplements, but then, you know, you're not getting a difference. And that's because you're, you know, we've got antagonists working against each other. So, important things there. There are some medications that certainly decrease our iron availability and our iron absorption from our nutrition. And first and foremost, iron needs to go through an acidic stomach in order to be, you know, broke down properly and be able to be fully utilized. So when we've got low stomach acid, we have extremely decreased iron absorption. So for all of you people out there that take proton pump inhibitors, H2 blockers, your ranitidine, famotidines, your pepsids, omeprazoles, all of the stomach acid reducing medications out there, as with most nutrients, they significantly decrease the availability or the body's ability to absorb them. So just make a note of that, right? And so if we know that we have those issues, we might want to reassess our diet, what we're consuming, why we need to have, or why we think we need to have a proton pump inhibitor, things like that. So really taking a deep, hard look at what you do in your daily life, so that we can maybe get off of those medications so that we can have better nutrient absorption overall, you know, bar none. For those of you that take NSAIDs, right, your ibuprofens, and your anti-inflammatories, right? So they don't affect absorption of iron, but they do increase the risk of GI bleeds, right? So increased risk of gastrointestinal bleeds. And microscopic bleeds, right? So, but that is where there's a potential to be losing blood. And if we're losing blood, if we don't have the red blood cells, we can't bind we've got less iron in our body. So, and also same goes with anticoagulants. And so your warfarins and your, why am I drawing a blank? Any stroke prophylaxis medications. So they also increase the risk of bleeding, right? Because we are not allowing the blood to clot as easily. So just to, you know, be aware of those things. And so, because that's what I'm here to do. We're here to educate and empower everybody to ask the questions, have the confidence to ask the questions, and be strong in taking care of your own health. And I think that's so powerful. And so that's why I love doing this. So, and then other things that we might not think about are antibiotics, some tetracycline, doxycycline, ciprofloxacin, things like that. Especially if you're on chronic use, it binds to any iron, binds to a lot of nutrients, as well. And so just to be aware of that. And so we want to help everybody feel better. Any questions out there on anything that I've talked about so far? You guys are pretty quiet today. Maybe we're all wanting to be under an umbrella in front of a warm campfire, or a warm fire right now. Not so much outside. Okay, so that is some of that regarding iron, low iron. And maybe I'll just kind of touch a little bit on the similarities and what goes on, why iron and thyroid are very important together to look at, right? I talked about the the symptoms of the low iron or poor thyroid function, right? So let's go back again, once again, right? Our fatigue, low energy, brittle nails, the loss of, lots of hair loss, hair thinning, weakness in nails, cold hands and feet. That's a big one, right? Because you're not getting a good enough circulation. Easily bruising, pale skin, random like tachycardia, racing heart. So those are all symptoms of iron deficiency, and they're also symptoms of thyroid hypofunction. So um, just just knowing that they do kind of correspond. So, but iron is required to actually make the thyroid hormone in the body, and so and that's because there's an enzyme in the body that is iron dependent, and that's called the thyroid peroxidase. So you might see on some of your labs the TPO antibodies, things like that. And so, but the TPO, that's your thyroid peroxidase. And that is what's responsible for converting iodide to iodine, attaching that little iodine to the tyrosine, and producing the thyroid molecule, your T4 and T3. So if your iron is low, your TPO, which is an enzyme, that activity decreases. And when that decreases, you don't get enough thyroid produced. And so that's kind of in a nutshell how that one works, right? And that's where like you can have normal labs, but impaired production of your thyroid. So just keeping in mind that if you think you've got low thyroid, you need to look at your iron as well, and vice versa. Low iron is also associated with the inability, or it decreases the ability of that conversion of the inactive thyroid, your T4, to your T3. And so it decreases the signaling in the body between the cells. And so even though the TSH, which is a marker of conversion in your thyroid, it can be normal, but yet you're still going to be extremely fatigued. And so that's really common. And that's why we need to look at the iron, especially like with women with heavy cycles, endurance athletes, extreme athletes, and even, and you see it a lot just because the extreme stress on the body, women that are extreme athletes like that, quite often they don't even have a cycle, right? So, and once again, that's our report card for our body and how we're doing hormonally. So things to keep in mind. Chronic stress, postpartum, women in postpartum, right? So even though your TSH is good, but you still have the extreme fatigue, make sure you're taking a look at your iron levels, your ferritin, the TIBC, and the serum iron, right? They all play the picture. Don't just allow for one marker to make that determination for, how you want to go about balancing your body back out. So quite often we see, and I think, and that's where I'm going to start requesting a few more iron labs, I think, for some of my thyroid patients. People are started on the thyroid meds when really it's that ferritin that's the low levels. So I guess I'm just going to keep harping on that because I think that's the easiest thing to remember. If we're looking at thyroid, if you're looking, for low thyroid, the fatigue, all of those things, look at both iron and thyroid. So, yeah, so that's that. I've got a few other questions that people that have been asking about, and I'm going to save those for next time, because what I end up doing is I take one question, and I'm not going to lie, I spend hours and hours and hours kind of researching and trying to bring the information to you. And so hopefully I am getting that across. And so for anybody listening, anybody that listens to this afterwards, send me some questions. Send me something that you've experienced. Send me something that your mom has experienced, your dad, whatever. If you've got a question, I'd love to work on answering that for you. So in the meantime, I hope that my message today regarding iron deficiency and the fact that it does kind of parallel thyroid issues, that you take that time, you take those questions, and you ask your provider to run the labs, run the full labs. We want full thyroid labs. You want TSH, free T3, free T4. Those are, kind of the minimum. Quite often we don't get that free T3, and the free T3 is so important for looking and determining what doses of things people need. Is taking a ferritin supplement the same as an iron pill? Yeah, so the ferritin supplement, I think a lot of that is also just labeling. So we would just have to look and see what exactly that ingredient is, right? So if you do qualify for actual low serum iron, low ferritin, then we do want to be supplementing, right? The most absorbable forms of iron, however, are that come in food, right? So let's think about our red meat, and then, organ meat, things like that. Those are the highest ones in the heme iron. But then there's also a lot of vegan iron options as well. And so that starts with your dark greens, the spirulinas, the cooked spinach. And the reason I say cooked spinach, because it is absorbed a little bit better, right? The body doesn't have to work as hard to break it down. Pumpkin seeds, pepitas, those are really good sources of iron. Quinoa, blackstrap molasses, just kind of be careful with that because of the, a little sweeter, so you probably don't need as much. Butter beans, tofu, as long as, and the soy products, make sure that they're organic, so that they're not the GMO extreme tofus, but prunes and lentils. So I would say like your lentils, your cooked spinach, your pumpkin seeds, those would probably be the three best forms of like the vegan based iron. And then, your red meat is the heme form. And so, so the more iron that you can get from your food, the better it is absorbed. However, the thing of it is that iron does not work in isolation, right? Iron just doesn't just work by itself. It needs those cofactors, right? So you want to be making sure that you're getting the supplements of your activated multivitamin, like a daily nutritional support, making sure that you're getting vitamin C. Especially if you're taking an iron supplement, you want to be, vitamin C kind of needs to go along with that, probably 500 milligrams at a time. The B6s, B12s, B9s, copper, magnesium, all very important for the absorption and the utilization of iron within the body. And so, yeah, great question. All right, folks. Well, my time is up. And so I will see you all. Tell your friends. Let's make this a Tuesday morning ritual, because I am really starting to enjoy this. So thank you all for being here, asking a question. Come with your questions next week. Even better, send them in early so that I can make sure I've got the best answers for you. Once again, I am Dr. Sarah Morrissey, Integrative Health Practitioner, Doctor of Pharmacy, representing Moses Lake Professional Pharmacy, as well as my own business, Winning Wellness. And so I'm just here to help educate and empower all of you to take control of your health. And if you have questions and concerns, give me a shout. Check out my website. I've got it down there on the winningwellnessllc.com. You can also reach us at mlrx.com. So I hope everybody has a fantastic rest of your day. Thanks for being here, and take care.